What if the body quietly tells us when life is nearing its end, and most people don't even realize it? Hospice nurses, who spend more time with patients in their final days than almost anyone else, have noticed patterns, not guarantees, not exact timelines, but common signs that often appear when someone is approaching the end of life. In this video, we'll walk through 19 of those signs, explained clearly, respectfully, and based on real-world observations. Before we begin, it's important to say this. Every person's journey is different. These signs don't happen in every case, and they don't predict exactly when someone will pass. If you're caring for a loved one, always consult a qualified healthcare professional for guidance specific to their condition. This video is here to inform, not to diagnose. 1. Increased fatigue and sleeping. One of the earliest and most noticeable changes is a significant increase in sleep. A person who was once alert may begin spending most of the day resting or drifting in and out of consciousness. Hospice nurses often explain that this isn't just being tired, it's the body conserving energy as systems gradually slow down. Even simple activities like talking or eating can feel exhausting. 2. Reduced appetite and thirst. It's very common for people near the end of life to lose interest in food and fluids. Meals may go untouched, and even favorite foods no longer appeal. This can be difficult for families, but medically it's a natural part of the process. The body no longer needs the same level of nutrition, and forcing food can sometimes cause discomfort rather than help. 3. Withdrawal from social interaction. A person may begin to withdraw, speaking less, avoiding conversation, or showing less interest in the outside world. Hospice professionals often describe this as a kind of inward focus. It's not necessarily sadness. Rather, the person may be mentally and emotionally preparing in their own way. 4. Changes in breathing patterns. Breathing may become irregular, sometimes slow and shallow, followed by deeper or more rapid breaths. There may also be pauses between breaths, a pattern known in medicine as Cheney-Stokes respiration. While it can sound concerning, it's a recognized pattern in end-of-life care. 5. Confusion or disorientation. Cognitive changes are common. A person may become confused about time, place, or even recognize familiar people less consistently. This can be caused by reduced oxygen flow, metabolic changes, or the body's gradual decline. Gentle reassurance and a calm environment can help reduce distress. 6. Changes in skin color and temperature. As circulation slows, the skin, especially on the hands, feet, and knees, may become cool to the touch or appear bluish or mottled. Hospice nurses often point out that this is due to blood being redirected toward vital organs. 7. Decreased urine output. Kidney function typically declines as the body shuts down. This can lead to less frequent urination and darker-colored urine. It's a subtle but medically significant sign that internal systems are slowing. 8. Restlessness or agitation. Some individuals may become restless, moving frequently, pulling at clothing, or appearing unsettled. This can be caused by discomfort, confusion, or changes in brain chemistry. Hospice teams are trained to manage this with comfort-focused care. 9. Vision-like experiences or hallucinations. It's not uncommon for people to report seeing or speaking to individuals who aren't physically present, often loved ones who have passed away. While this can be surprising, hospice professionals approach it with openness and reassurance rather than correction, as these experiences can be meaningful to the individual. 10. Changes in blood pressure and heart rate. Vital signs often shift. Blood pressure may drop, and the heart rate can become irregular or weaker. These changes are typically monitored in clinical settings, but may also be observed indirectly at home through physical cues like faint pulses or dizziness. 11. Difficulty swallowing. As muscles weaken, swallowing can become more difficult. This increases the risk of choking or aspiration. At this stage, care often shifts to keeping the person comfortable rather than maintaining regular eating habits. 12. Loss of interest in surroundings. A once engaged individual may stop responding to television, conversations, or activities they previously enjoyed. This reflects the body and mind gradually disengaging from external stimuli. 13. Increased sensitivity or reduced awareness. Some people become more sensitive to light, noise, or touch, while others may seem less responsive overall. These neurological changes vary, but both patterns are commonly observed in hospice care. 14. Periods of clarity, rallying. Interestingly, some individuals experience a brief return of energy or clarity after a period of decline. They may talk more, eat a little, or seem more alert. While this can feel encouraging, hospice nurses often note that it's sometimes a temporary phase rather than a sign of recovery. 15. Changes in hearing and response to sound. Even when a person appears unresponsive, hospice nurses often observe that hearing may still be one of the last senses to remain active. A person might not open their eyes or speak, but they could still react subtly, like a slight change in breathing or facial expression when hearing a familiar voice. Because of this, caregivers are often encouraged to continue speaking calmly and reassuringly, even if there's no obvious response. 16. Increased time in a semi-conscious state. As the body continues to slow down, individuals may spend longer periods in a state that seems between sleep and wakefulness. They might briefly open their eyes or murmur a few words, then drift back into unresponsiveness. Hospice professionals often describe this as a natural transition, where the brain is gradually reducing its level of alertness. 17. Changes in muscle control and movement. Muscle weakness becomes more pronounced, and coordination may decline significantly. Simple actions, like holding a cup or adjusting position, can become difficult or impossible. In some cases, there may also be involuntary movements or slight twitching. These changes are typically related to the body's reduced energy and neurological shifts, not necessarily pain. 18. Altered sense of time and awareness. A person nearing the end of life may speak about events as if they're happening in a different time frame, mixing past and present, or referencing people and places from long ago. Hospice nurses often see this as part of the brain's changing perception rather than confusion alone. It can reflect a deeply personal and internal experience where memory and awareness begin to blend. 19. Gradual letting go and emotional closure. In the final phase of life, some individuals begin to show signs of what hospice professionals often describe as letting go. This isn't something that can be measured medically, but it's frequently observed in subtle, meaningful ways. A person may start expressing things they hadn't said before, offering words of gratitude, forgiveness, or even giving quiet instructions about personal matters. In other cases, they may simply become more peaceful, as if reaching a sense of acceptance. Hospice nurses sometimes notice that individuals seem to wait for a certain moment, perhaps until a loved one arrives or until they've had a chance to say goodbye. Others may choose to pass when the room is quiet and they are alone. It's important to understand that these moments are deeply personal and don't follow a fixed pattern. Not everyone experiences them in the same way. But when they do occur, they often carry emotional significance for both the individual and their loved ones, creating a calm, supportive environment where the person feels safe and respected can help allow this natural process to unfold with dignity. Understanding these signs can't change the outcome, but it can change how we show up in those final moments. With patience, presence, and compassion, we can help ensure that no one faces the end of life alone. If this video gave you clarity or comfort, consider sharing it with someone who might need it.